Hello and welcome to this special episode of Techopia Live. Today's topic is why Medtech is the next big thing for Canadian healthcare. I'm Michael Curran from the Ottawa Business Journal. Canada's healthcare system has been forever changed during the pandemic. To withstand the growing pressures of backlogs, staffing shortages, and an aging population, healthcare providers need to rapidly adopt new technologies. We need the type of technologies that make sense for fast-paced, complex workflows of healthcare professionals. In today's show, we have two experts from a company that's a flagship in Ottawa's technology sector. A fact that's not too well known, this company is at the forefront of the healthcare industry's transformation, empowering communities to lead safe and healthy lives today and tomorrow. The company I'm referring to is none other than Calian Group. Let's watch this short video for an overview of the company.
Question: what really makes the world go round? The answer is simple: confidence. Our name is Calian. We engineer confidence in the form of technology solutions our clients and their customers rely on to help them grow and succeed. Solutions that move the world forward. Because that's what happens when organizations at the forefront of their industries innovate to help people stay safe, communicate, learn, and lead healthy lives.
That's a great overview of Calian Group. Eager to dig into this issue, so let's meet our first guest now so we can learn about how Calian is shaking up medtech and what that means for the future of Canada's healthcare industry. First, let's welcome Tazmin Leipsig. Welcome, Taz.
Hi, thanks for having me, Michael.
And next up, let's welcome your colleague, Kaytlin Sadler. Here's Kaytlin.
Hello, and thanks for having me as well, Michael.
Taz, we're going to start with you. Give us an overview of what you do at Calian and the group that you're leading.
Perfect. I'm Tazmin Leipsig. I'm Director of Product for Calian Digital Solutions. So Calian Digital Solutions was formerly a company called Dapasoft that was purchased by the Calian Group. Dapasoft focuses on health technology primarily, delivering different solutions to people, everything from custom development work, managed services, helping with digital transformation in healthcare, as well as two flagship products under the Curran platform. One being an interoperability layer that can help connect many different systems and provide that fluid experience for providers and patients alike. And the other being a virtual care collaboration and secure messaging platform that really helps connect those patients to providers and improve workflows within hospitals, health authorities, and health institutions. We come from a large background, been around since the 90s, helping all kinds of hospitals and health authorities across Canada, as well as in the US. And we're excited today to talk a little bit more about how we can promote that integrated healthcare across platforms.
Great. Thanks, Taz. And Kaytlin, let's bring you into the conversation. Give us a sense of your role at Calian and maybe a high-level view of what Calian's doing in MedTech.
Excellent. Thanks so much, Michael. So my name is Kaytlin Sadler, and I'm the Vice President of a company called Alio Health Services. Alio Health Services was acquired by Calian in January of 2020, so we're just 2 years into our acquisition phase. And at Alio Health Services, we were founded in 2012, so it's our 10th birthday this year. And we run something that's called a patient support program. What a patient support program does is it facilitates a patient's access to healthcare services. And within a patient support program, we do that in two ways. The first, of course, being by facilitating financial access to healthcare services. And we do that through kind of an internal team who's typically call center based. And we also facilitate financial access through our technology solutions as well. We'll tell you a little bit more about that later on in the show. And the second way that we facilitate a patient's access to healthcare services is through a service delivery team, which is a team of healthcare workers as well. So currently across Canada, coast to coast, we have about 3,000 healthcare professionals, primarily doctors, nurses, as well as some allied healthcare professionals as well. And we also operate across 10 different countries across the globe. So we have quite the reach, and the purpose of those healthcare workers is, of course, to actually deliver the healthcare solutions to patients in a community setting. So be that their home or their work setting or another place that's convenient for the patient.
Well, thanks, Kaytlin, and happy anniversary.
Thank you.
So we've divided today's show into 3 topics. The first topic's a really interesting one to me because we just talked to LSpark on Techopia Live just a few weeks ago. So you can see it there. Calian and LSpark showcase the first cohort of Medtech Accelerator. Our second topic, we're going to talk about this thriving Medtech ecosystem and how it brings value to healthcare and economy. And in our third topic, we're going to be looking at how we solve some of the complexity through innovation, because my goodness, healthcare is, as we'll learn and as we know, a complex industry. So let's go on to a topic number 1 right now. And Taz, you're going to kick things off. Calian's partnered with LSpark to start a Medtech accelerator connected to the Calian integration platform. Tell us more, Taz.
Yeah, so we've been partnering with LSpark on this Medtech accelerator. They're well known in Ottawa. We've assembled a cohort, which was honestly a ton of fun to put together. So LSpark did a lot of the work in finding us these fantastic Canadian health startups. We interviewed many. We got a lot of different pitches. We were able to explore the different solutions with plenty out there providing tons of great solutions to what our healthcare system is facing today. Through that process, we were able to trim that down to the participants, virtual hallway, Lime, Coalesce with their complex care plan, and Alia was a participant as well. We have a demo day coming up on June 15th, which we're all very excited for. We get to kind of take all of the hard work we've been putting into this, and that's our culmination event, so everyone can see the great work that these startups have done in working with our integration platform called Corolar to bring their solutions to clients broadly across Canada and leverage that interoperability approach. So I've quite enjoyed mentoring these groups and these startups. So they're all coming at healthcare with very different focuses, where that be more focused on primary care delivery or in-hospital delivery or electronic patient-reported outcomes, or in Kaytlin's scenario, delivery of health services. They all have something really important to bring to the table. So being able to support them, connect them to various clients where they have real opportunities to improve the Canadian healthcare system has been utterly delightful. So great groups that we're working with, and we're very excited to show everyone what's coming out of that.
Sounds like a very interesting experience. And Kaytlin, you participated in the accelerator to take your product in a new direction as a SaaS solution. Can you tell us about the experience you had?
Yeah, absolutely. So it was a bit of a unique experience for us because, of course, we are a Calian company and we have been around for 10 years. So we are a mature health services company. But what is new for us is taking a product that we use internally to offer our healthcare services and go to market with a SaaS solution. And that was really the benefit or the driver behind our participation in the LSpark Accelerator. So kind of to take us back 10 years when Alio Health first became an organization, of course, we knew we wanted to deliver healthcare solutions, and we knew that we were going to deliver patient support programs. And at the time that we were entering the market to deliver patient support programs, we knew that our clients, which at that time 10 years ago was primarily pharmaceutical companies, we knew that our pharmaceutical clients had a lot of pain points in the way that the patient support programs were being delivered. The patient support program solutions were very costly, and they were, for the current providers that were offering patient support program solutions, their key performance indicators were just not on par of where our pharmaceutical companies wanted them to be. And what it came down to is really simplifying access to healthcare services that's fast. And so we actually came into the market as a health services company 10 years ago with a proprietary software solution. So right from day one, we developed a proprietary software solution that is called Nexi. And what Nexi allows us to do is it allows us to automate the delivery of healthcare services. So something as simple as, the assignment of a nurse to a patient, we can automate that so that you can effectively order on-demand healthcare services through a technology solution. And we came into the market 10 years ago, again, as a services company, healthcare services company, and we had the solution. And our solution was allowing us to offer our healthcare services in such a timely and high quality and low cost fashion that we really were able to grow our services business quite quickly. If we fast forward to being acquired by Calian in January of 2020, it became apparent that this internal software solution that we have to deliver our services is something that could be offered as a SaaS solution as well, and it could actually benefit the healthcare ecosystem as a whole. So really our participation in the LSpark accelerator was an opportunity to work with our cybersecurity and IT division to really build a roadmap of how do we take this internal product that we have to deliver services and transform it into a SaaS product. So our participation in the accelerator enabled us to work directly with really experienced leaders in the SaaS world and create that roadmap to transition our product into something that can be leveraged as a product solution rather than just offering healthcare services.
Thank you, Kaytlin, and great that you're able to work with the folks at LSpark. That's awesome. So listen, in our second topic, we're going to be talking about why the thriving medtech ecosystem brings value to healthcare and the economy. And Taz, you're going to tackle this one up front. And so tell us, why is it so important, Taz, to Canadian healthcare?
Well, integration at a core helps connect our systems and our providers that have been previously working in a little bit of silos. So the CoreLR platform has been around for quite some time, and our primary focus from the past was integrating source systems like EHRs and EMRs and bringing together data that was typically kept separate, normalizing that, transforming it, allowing it to be consumed by other applications in an easy fashion so that people could leverage this data and make better informed decisions about their patient care. What we're seeing now is a trend and a new era towards interoperability that is going beyond just the hospital needs, but from vendor to vendor. So with that allows us to better connect vendors together so that we can all service these hospitals, health authorities, and health institutions, while creating the best-in-class apps and bringing together what we focus on in the different areas. So when you have different systems that have their product development focused on one particular area, they're going to provide the best product in that space. So instead of one company attempting to do everything all at once and not being able to provide that catered experience for that particular topic or that particular function, you now have the ability to connect all these different systems that were likely implemented with good intent, but because of the lack of connectivity, doctors and nurses, other health providers are not always able to give the best care possible because they're leveraging so many different systems and need to be better integrated.
That's a great point on interoperability. Easy for me to say. Kaytlin, you were going to talk about medtech not only being for big companies, it's also relevant to some smaller players. Do you want to expand on that thought?
Yeah, no, absolutely. And I think I would actually start by saying one of my favorite quotes that's out there that really explains the need for medtech is necessity is the mother of invention. We've really all heard it before, but what that means for a company like Alio and how we really ended up here after kind of 10 years being a healthcare services company is that we realized on day one that the solutions that were available for small to medium size healthcare organizations, particularly startups at that time, those tools and the technologies, they just aren't available for small to medium sized companies. So necessity is the mother of invention really kind of describes how, I guess, really the evolution of Alio. We created a product, which is our Nexi healthcare digital platform. And we created a product because it was necessary. It enabled us to deliver the services. And had we not had that technology solution to deliver, faster, more convenient care, I'm not sure that we would be where we are today. I think that we would be very similar to the other kind of small to medium-sized companies that are struggling to get past a certain point because they just don't have the technology solutions that are available to them. So creating a healthcare ecosystem to me means that we're giving healthcare organizations the ability to pick and choose the technology solutions that they need for their business. Effectively think of, any business has, let's say, a number of different tech solutions that they work with. Maybe they have 10. And not every healthcare organization is looking for all 10 tech solutions. Some of them are looking for more of a modularized approach. I just need the HR module. I just need inventory management. So creating that healthcare ecosystem enables those small to medium-sized companies to pick and choose the products that they need for their business, but it also enables them to remain connected to the broader ecosystem. And that's really the power of Calian Digital Solutions and what I like to call the interoperability engine. It's allowing those small to medium-sized companies, as well as large enterprises, to connect to the ecosystem through a series of standard APIs. And I think that's the power of having a medtech ecosystem.
And we're going to talk a little bit about patients' expectations. Very important to keep patients kind of at the center of the discussion as we're talking about all this technology. How have patients' expectations changed, Kaytlin?
Yeah, absolutely. And so it's really about the patient at the end of the day. What we would like to be able to do through a medtech solution is enable the patient to more simply access healthcare. So rather than have the patient, let's say I need a mental health worker to come to my home once a week. Instead of the patient trying to navigate what coverage is available through my insurers, who are the different providers out there who would be available to me? Where would I need to travel to be able to access healthcare? Instead, we'd like to have the patient come into our ecosystem, and the technology solutions will guide the patient and effectively tell them which way to turn, so that it's less complicated for the patient in the end. But it is more than just the patient. It's also about reducing the burden on our current healthcare system. Even if a patient does know where to turn for healthcare services, sometimes our healthcare system can be so bogged down that things like wait times can be a big hurdle for a patient to overcome. So I think we'll get into that a little bit more later on in this conversation, but it's really about segueing and transitioning the healthcare system into more of a decentralized model. So not only can our technology solutions help a patient navigate through a complex but really great healthcare system, but it's also about how we can structure our healthcare workers and give the technology solutions to our healthcare workers to be able to operate within the communities.
And Taz, I think we've talked before about how patients want to be more proactive in their healthcare. Do you want to expand on that?
Absolutely. So we're seeing a lot of trends towards patient-directed care. So when it turns out that a patient takes proactivity in their healthcare, they have better reported outcomes in a whole. We're also finding that patients, especially in different demographics, their healthcare is also managed by various support groups, or they're sometimes independent. Their daughter could be taking care of them. Their healthcare worker could be taking care of them. And we're seeing a loss in continuity of care between different providers that are involved in anyone's care continuum and their experiences. I mean, we can self-book with many different platforms out there. I can self-book for my banking. I can self-book for restaurants, etc., my passport office. However, a lot of our healthcare institutions and organizations out there don't have the technology available to allow patients to self-book, to allow patients to consistently view their own results and improve their healthcare and make better health decisions, and allow patients to really kind of take care of that health and also be provided education in a consumable fashion. So a lot of our patient-focused solutions are heading in that direction, and including some of our participants from the cohorts. We do have an electronic patient-reported outcome participant that is primarily focusing on how the patients have experienced that healthcare and how can we improve it, creating those dashboards, making better decisions to ensure that they are getting the right care and education. To also better improve the patient outcome, we need to fix some of the problems that the providers are facing. So there is an extreme amount of burnout, especially during the pandemic, where physicians have adopted various methods of technology to provide care. There was a very knee-jerk reaction to adopt whatever made sense at the time to provide virtual care, which has now become an expectation for patients. So every patient expects this at some point in their journey, there may be a virtual care session. And we picked up as many as we could or as quickly as we could, without realizing that sometimes when you quickly adopt technology without thinking of how everything is connecting, you're actually adding steps for providers. So we experience a lot of what we like to call disconnected care. We have found that healthcare is not turnkey. So having a vendor as well as solutions that are versatile enough and Kaytlin touched on this a little bit, to be able to connect those systems in a way that makes sense for that particular organization is the best way forward. So to reduce the strain on the healthcare system, which improves Canadian healthcare system economically, reduces wait lists, it improves the patient outcomes, we need to be able to provide the patient care in a manner that makes sense for them and their provider. So what I mean by that is that adaptive care model where a patient could need to be seen virtually or in person, and we need to be able to adapt to that quite quickly and have systems that can do both. Patients are now expecting that they could have therapeutic moments through messaging, so secure messaging platforms, virtual care consultations, in-person consultations. And we need to be able to document, store, and transition this care, all with systems talking to each other so that patients have the best outcomes and providers can collaborate together. There's often more than one provider that's involved in providing care to a patient. So keeping them all connected is really the way forward. And we're excited to work with different groups to facilitate that shift in healthcare.
Yeah, technology can really be a help here, but the complexity of it, I'm understanding, can be a little bit of a burden, particularly if there's all sorts of systems for healthcare professionals to deal with. Listen, in our third topic, we want to talk about why this is such an exciting time to be part of Medtech. And I think, Kaytlin, you were going to kick us up on that?
Yeah, absolutely. And I'd also just kind of segue off of something that Taz was just talking about, adaptive care. I love that terminology, Taz, adaptive care. One thing that we've been really focused on at Alio Health is providing our patients with something that we've been referring to as convenience care. So I really think that the expectation from patients right now, or from the Canadian healthcare system as a whole, is really to transition more towards a decentralized healthcare model. And what that means is offering convenient healthcare solutions to patients, or in other words, offering healthcare solutions to patients when and where they need it. So that could be, for example, in locations such as their home or their work, or even, as Taz mentioned, virtually. But there is some limiters on virtual care because there's only so many healthcare solutions that we can actually deliver virtually, of course. But I think that what's important to recognize is that in order for a healthcare organization to transition into this convenience model, or in other words, this on-demand healthcare model, that means that our healthcare workers need to be located within the community. So rather than having our healthcare workers located in a central hub location, such as an institution or a hospital, and the patients travel to that institution, it's more of a hub and spoke model where the hub is actually the technology solution that connects all of our healthcare workers together, and our healthcare workers are located in the community. One example that I wanted to give today is how that can be used in a situation such as a pandemic. So if you have a healthcare system that is operating as this hub and spoke model, you're able to adapt, in Taz's term, I love that adaptive care model. We're able to adapt to the environment around us because we have the existing infrastructure there. So for example, when the COVID-19 pandemic hit and our healthcare system was really bogged down by supporting ICUs as a result of COVID-19 infections, we didn't have as many public health resources available to actually administer the vaccines. So we actually worked with the government to transition to a hub and spoke model just to support COVID-19 vaccination clinics as well. So bringing in the nurses and the healthcare workers from the community to support the public healthcare system, who was really busy supporting ICUs at that time. So the benefits of having that decentralized healthcare system are enormous, but they wouldn't be possible without the technology solutions that support them. And that's really the benefit of Medtech solutions or companies like Calian that have a product service hybrid. Michael, you asked me, why is it exciting to be part of Medtech right now?
Absolutely.
I think that one of my biggest takeaways from participating in the LSpark Accelerator is something that my mentor said to me. And he said, Kaytlin, you're really focused on offering healthcare services, and that's great. You like to help people, and that's generally, why anybody who's working in the health industry is here, is because we have some kind of drive to help people. And so one of the big questions for anybody who works at a healthcare organization is, how can we help more people? And again, one of my favorite lessons learned that was through the LSpark accelerator is when my mentor said, when you offer services, healthcare services, you are limited by how many people you can help, by how many people you can hire. So your resources are your limiting factor. If I only have 3,000 nurses and they can support 3 patients each, then I would be able to help 9,000 people. Simple math. If you're offering a technical solution, or you're bringing a SaaS product to market, your limiters are more or less removed. So the scope and the reach of and the impact of who you're able to help has just become much more enormous. So for me, the really exciting part about being in medtech is being able to increase the scope of the impact that we can have.
And Taz, I think it's a great time for women to be in this high impact field. What are your thoughts, Taz?
I definitely agree. I'm seeing it a lot more. I would love to see more kind of entering the field, though I will be honest, it's a little lonely sometimes. And I want to see more people inspired. There's many different positions out there. I know for sure I'm director of product, but they never taught us about that in school. So I'm hopeful that, things are shifting. People have a closer eye on technology, that people are less intimidated to join technology teams out there. And I love some of the mentorship programs that exist with females to kind of promote that. It is still a male-dominated industry, but there's definitely lots of room for females. And it's been exciting working here. I mean, at the end of the day, health tech especially is important to me because we do get to improve a patient's outcome, right? At the end of the day, we get to go to sleep knowing that we helped someone get their, the report faster. They got their medical services faster. They were able to, communicate with their physician faster and begin healing. So it's just a very exciting industry. And I love to see how the model is changing. So the pandemic was, it's not a good event, but there's some silver linings in the push for better health technology. So I will call that out, and I've seen that reflected across the board. So Kaytlin did mention a hub and spoke model, but I'm also seeing models where people are trying to combine services and deliver those services the best way to the patient. So taking things like community services and medical services that are typically separate and linking their systems together, normalizing that data, providing solutions that both teams can operate under so that collaboration happens better. And I'd love to use an example from actually an Ottawa client of how that's played out, wherein you can take an elderly person who's not typically going to travel to the institution too often. It's quite an event for them to travel to that institution. They can receive a diagnostic imaging procedure. If the results aren't the greatest, they can connect them to a community service like Meals on Wheels, where now this person is immediately surfaced in the facility. They don't have to go home and come back in. So we're seeing a lot of that collaborative approach by connecting the different services, by connecting the different technologies, and keeping everybody up to date on the patient's health. So it's moving away from that siloed approach and more towards what's best for the patient, and should we just be sharing our data and our information to provide the best care to the patient. Kaytlin talking a little bit about servicing different communities and having people in the community is also very important. I'm in BC, and in BC, there's a ton of remote communities that need that type of service where providers and specialists aren't there. They're not in the northern communities as prevalently. And I think that's the same in Ontario as well. And we see that across Nunavut and the Northwest Territories as well. So being able to provide technology services where partial can be virtual, well, we can also send certain providers to the remote communities, supports that hub and spoke model. And I'm happy to be the technology that's kind of at the center of it and connecting everybody and making sure that patients get the best care possible.
That sounds very rewarding, I'm sure. So let's move to our 3 takeaways. So we'll bring that graphic up on screen. And Kaytlin, do you want to kick us off?
Absolutely. So I think probably for me, one of the biggest takeaways is again, the scope of the impact, or how many people you can help by combining your healthcare solutions and your technical solutions together, otherwise known as Medtech. I would roll it back to a conversation we were having earlier today around necessity is the mother of invention. It's really about having that experience delivering the healthcare solutions from, a small startup company to the more mature company that we are today, we've experienced all of the pain points that a healthcare services company has. And by working with our counterparts on the Calian Digital Solutions side, we're able to combine our talents together, the med and the tech together, to offer these really innovative med tech solutions that are solving real world problems. And we know that they're real world problems because we've experienced them ourselves on the services side. So that's really the key takeaway for me. It's the reason that we're in med tech. It's why it's so exciting, and it's why it's the place to be right now.
It's a great motivation. And Taz, do you want to chime in on a couple of the takeaways?
I think that I'm just excited about how many Canadian startups there are striving to improve healthcare in a whole. And I'm really happy that Calian is participating in this accelerator and that we can support them. I don't think Calian's slowing down anytime soon. I think that even after this cohort, it has been quite successful, that we'll be looking to continue this program to a degree and keep promoting that Canadian healthcare. Our healthcare system is under strain right now, and we can do everything to help maintain the way that it is. And really, we would just want to drive that interoperability and drive that innovation.
It's badly needed for sure. We really do need to embrace this type of technology. So before we wrap up, let's bring your contact information on screen. I'm sure there's people watching this that are wondering, how do I contact Taz or Kaytlin? And here we go right here. So Taz, you're at, the email's right there at dapasoft.com, and Kaytlin, you're at aliohealth.com. Listen, thank you so much for being part of the show. My goodness, what an incredible amount of information we've gone through here today. And you provided a really compelling reason why people should be turning to Calian Group to help solve the interoperability, looking at some of these patient-centric systems. So thank you very much, both to you, Taz and Kaytlin. Appreciate you being here today.
Thank you, Michael. Thanks for having us.
Thanks, Michael.
All right. As we wrap up, a reminder that if you want to stay connected to Ottawa Business Journal, you can visit obj.ca. There's updated news almost posted on the hour. In fact, Calian's making headlines all the time if you want to check them out. I highly recommend as well you subscribe to our email newsletter. That's Monday to Friday. It's called OBJ Today. And of course, you can follow us on social media. Lots of people opting to follow our LinkedIn account these days. And of course, since you're watching on YouTube, you can click the red subscribe button and then also hit the little bell icon if you want to be notified when we're live with new videos. Thank you very much for joining us today. Stay well and bye-bye.